Okay, we've got some blood results back in and we're ready to interpret them. So the first thing I'm going to talk about is routine screening things that are part of our essential health benefits. Our lipid panel, our comprehensive metabolic panel, and our complete blood count. So for me, I got my lipid panel, and comparing to last year, it's pretty similar. My total cholesterol has come up. It was a 189 and now it's a 200. My HDL, which is my protective type of cholesterol, is holding pretty good. I'm at a protective level of 77. My triglycerides are great. Triglycerides really reflect both a combination of fat and sugar, so this tells me that my blood sugars are staying really good. And so triglycerides for me are a 57. And then my LDL has creeped up just a little bit, but I'm not too worried about it. It was down to, I can't remember exactly, I think it was like an 88, 89 last time, and now I'm at a 109. So ideally that would be below 100, but it's still really close to the ideal range. I do care if LDL starts to get above 120, 130, and that's just because LDL really reflects a more pro-inflammatory type of cholesterol and is a sign that you're probably not eating as balanced as you could be. And I know this is a controversial topic and people will say cholesterol does not contribute to heart disease, and other people will say cholesterol is absolutely really important, and the truth is always somewhere right in the middle. It absolutely does matter. Like I said, LDL is a pro-inflammatory type of cholesterol, so we don't want excess amounts. It is essential for building a plaque. You will not build plaques in your bloodstream unless you have cholesterol available. That is true that some people will build plaques even if they don't have excess cholesterol, and maybe someday I'll do a video on a little bit more in-depth look at cholesterol, which would be like a lipoprotein profile where we can kind of take a look at those subparticles of cholesterol. But for a basic lipid panel, I'm just kind of using that as a general assessment. So what I know from this is pretty much makes sense with what I was anticipating. I haven't been watching my fat intake so closely recently, and so I know that I've been getting a little loose there. And I'm not a proponent of a low-fat diet, but I am a proponent of appropriate amount of fats, especially in relation to carbohydrates. And so I know that I've just been having a little bit more fat in my diet. So good opportunity to remind myself to take a closer look. Next piece of my panel is Comprehensive Metabolic Panel. So this looked at my fasting blood sugar, which was good. My fasting blood sugar is a 92, which is what I'd like to see. My EGFR looks at my kidney function, and it's excellent at 112. BUN, urea nitrogen, creatinine, all in good ranges, which are other reflections of my kidney function. All of my electrolytes are in balance. Our body does not really let our electrolytes get out of balance very easily. It's essential for all functions of our body for our electrolytes to stay in balance. So this is really just saying that I'm not very sick, which I already knew, right? I have good liver function. I like to see AST and ALT down in the teens, and my AST is a 16 and my ALT is a 19, reflecting that I don't have any liver inflammation going on or anything that would show that my liver is pissed off in any way. So CBC, so this looks at our red and white blood cells. We use this as a screening tool primarily to look for things like anemia or even white blood cell cancers or even a sign of like some acute or even maybe some chronic infection that might be going on. So you might see some white blood cells be out of range or red blood cells be out of range depending on what's going on. So for me, all of that looks great, nothing of note there, which is what I expected. There's even a marker in here called eosinophils, which can be a marker of like a more allergic type of experience going on, and my allergies look great. So overall, I am really happy with my basic routine screening.